We're going to do a very special live today with pediatric dentist Dr. Erin. I get so many questions all the time about when to start brushing baby's teeth, what toothbrushes to use. I get questions about, do you use fluoride? What kind of toothpaste do you use? Like all those types of things. So I have invited Dr. Erin on. She's a pediatric dentist. She's going to go over a lot of stuff. We're also going to talk about tongue ties, lip ties, oral habits like nail biting, and those types of things. So, Erin, if you're on here, please request to join live. Hi, guys. If you guys have questions, please put them in the chat or whatever this is called. Put them in the chat. Erin, I see that you joined. Raise your hand. Let's bring you on. Yay, here she comes. She actually helps me too. Like I ask her questions all the time about my own kids. Hi, Kevin. I see Kevin's on. Kevin, pay attention because your baby's going to need this information soon. Hi, Erin. How are you?
Hello. How are you? Good to see you.
You too. Okay, so I was telling everybody that you're going to be answering a whole bunch of amazing questions. So Dr. Erin is a board certified pediatric dentist in Pittsburgh, and she shares so much knowledge and information and is really helpful. She has a very big practice. She does a lot of not just the pediatric dentistry, but also like oral habits, like nail biting, thumb sucking, like stopping those habits. And also like airway, that has a lot to do with kids' facial development and all of that. And also like frenectomies and all of that when needed. She just did like a 1-week-old baby who really needed it, and mom's super happy.
Yeah.
So let's start with the basics real quick. Tell us the basics.
Well, you covered it pretty well. You know all my basics.
I know them, but not everybody else knows them.
Exactly. For everyone else here, I am Dr. Erin. I am a board certified pediatric dentist, like Dr. Yasin said, in Pittsburgh. I have, when she says big, numbers wise, yes, but office space wise, not so big. We make it definitely more boutique feel so that we have time to do things like airway and frenectomies and this bigger picture type of focus rather than just focusing on, oh, you have a cavity, let's fix it. We're trying to do more preventive, whole body type of care.
Okay, so let's reverse this because I want to talk to you about things that I didn't even know until we started talking about it, about how like picky eating, sleep habits, and all of that could also be related to maybe like a tongue tie or a lip tie or something like that. So can you share a little bit of information about that? And we are getting questions, so I'm going to read them as we go, but I'd love for you to share that information because I think a lot of parents don't know. I mean, I'm a dentist and I didn't even know some of these things. So share that information with us. And like if any of you watching see yourself having these types of issues, you could always reach out to Dr. Erin. She's happy to answer them. And then if you need a consult about something, like, you could find someone in your area or go visit her. Okay, so go ahead, tell us.
Okay, so it's a lot to say in a quick recap, but like you said, let's take, for instance, picky eating, dealing with, as it goes with tongue ties. So sometimes what I'll see, oftentimes actually, is, toddlers are toddlers, kids are kids. They might have their preferences of certain things, but as it goes on, if they're really, really just focusing, especially towards softer, mushy foods like buttered noodles, mac and cheese, mashed potatoes, and very rarely eating anything like raw, crunchy fruits and vegetables, not cooked vegetables because those get mushier, but like raw, crunchy fruits, veggies like raw baby carrots, raw apples, things like that, that can indicate something going on in the mouth, and let's say specifically tongue tie. When we chew, if you do not have that ability to elevate your tongue all the way to the roof of your mouth, which is what often happens with a tongue tie, then you're not going to be able to physically chew hard, crunchy foods, but also it's very tiring. So your body is natural. Your child may not be able to elaborate or say to you, I don't want that food because it's tiring or because it's difficult for me to chew or swallow. But that's literally what their body is saying, that this is going to be tiring. this is going to be hard and maybe even unsafe because I can't elevate my tongue all the
I
way
can't
to
chew it.
match it, chew it enough,
Yeah.
and I might gag or
Yeah.
choke on it.
Got
So
it.
then you see those kids aiming towards more picky eating.
Got it. Got it. Okay. Yeah. And then sometimes I feel like parents, like there's this wave of people I feel like who are just doing a bunch of lip releases and tongue releases that don't necessarily need it. It's just like happening across the board. And what I love about Erin is like she's so particular. She has like a questionnaire that she goes through with parents. It's very thorough. She sends them to consult with like lactation specialists or like other doctors just to make sure. So, like, what are things that people can watch out for so that their child is not put in a situation where, like, it's like, oh, it's just a lip tie, tongue tie release that needs to
Yeah,
happen, and then they're just doing it. So, things to look out for. Let us know.
yeah. Actually, I did do a post a little while back, which was like red flags to look for in a tongue eye provider or something like that. So
Okay.
definitely check
Very
my
good.
Instagram. But I would say main things is are they doing an in-person consult with you? That's number one. You can absolutely not diagnose a tongue, lip tie, buckle tie, anything like that just from one singular picture. That is like, there are pictures that you're like, ooh, something probably looks like it's going on there, but you absolutely we have to be able to feel the area. We have to be able to see that tongue in motion. So that would be number one, making sure a consult is in person. Number two, do they utilize other providers? Is it just you come in and 2 seconds later they're snipping or lasering away? Or are we discussing, have you seen a lactation consultant? Have you seen a feeding therapist? Have you gone to occupational therapy? Have you had a release before? There's so many things that go into it
Mhm.
that it's on rare occasion. The one I did the other week was rare,
Yeah.
where we did it right when they came in, but we had gone through all the protocols. But it's on rare occasion for me, at least, that right away I'm doing that release
Yeah.
because there's so many steps. I want to go through so many avenues. I want to make sure you travel before we just up and release a 1 week old or something like
Yeah. Or
that.
even a 5-year-old or, so
Exactly.
yeah.
Exactly.
Okay, so we do have a question. It says, my child is 5, recently visited the dentist, no cavities, but recently her top tooth turned gray. It's not loose, but it bothers her now. What are your suggestions?
So that's tricky because I can almost guarantee you, even if you don't remember a specific injury, that is like textbook for some type of injury to that tooth.
Mhm.
And I always tell the parents in office, it can be seemingly minor. It could be like
A
a
toy.
spoon or a Lego that hit the tooth. Yes, exactly. And then
Mhm.
over time, it's like a bruise on the tooth. If it doesn't hurt her, it doesn't bother her. I know 5 is like getting into kindergarten, school, and they may be more concerned aesthetically. But honestly, it's more aesthetic than anything. And I really try to emphasize to parents that, and that tooth is still doing its job. It's helping them chew, talk, eat properly.
Yeah,
So
and
we
hold the
try to,
space. You
it's
know,
holding space. Exactly.
yeah. So I recently had a friend whose daughter had some dental work, and they called me from the pediatric dental office, and they were like, "Should we do this or should we do this? Like, should we just pull the tooth?" And I was like, "No, no, no. Treat the tooth, right?"
Mhm.
So I think people think, "Oh, baby teeth, they're fine.
Yeah.
Like, they're just trial teeth, like
Yeah.
And I have to say, first of all, some adults have to keep their baby teeth, like their permanent tooth
True.
never comes in, right? It's
Very
rare,
true.
but sometimes that happens. And also, any infections that happen in a baby tooth lead to infections in the adult tooth. And I think once the bacteria establishes in the mouth, that then you become high risk for decay. So,
Exactly.
can we speak a little bit about why we should care about baby teeth and how to care about baby teeth? We do have a question here of like, what's the best toothpaste to use
Yeah.
also. So, let's go over that too.
Yeah, so you said you hit a lot of the nails on the head. Number one, it does hold, these baby teeth do hold space, physical space for your adult teeth down the road. And everyone, if possible, wants to try to avoid orthodontics, which also goes into the airway stuff, but that's a whole nother rabbit hole. But we want to try to physically hold space.
Yes.
Cavities cavities themselves technically are infections, but they can turn into a true abscess or dental infection, which
Yeah.
can spread to the developing adult teeth and or throughout the rest of your body. When I was in residency, even now, I've seen unfortunately plenty of kids who come in with their eye
Yeah.
swollen shut because infection is,
Yeah.
or the floor of the mouth. If that gets swollen, that can literally cut off your
Yeah.
airway. It can get bad. So that's number two. It can turn into infection. And like I said, sometimes we have to do what we have to do with taking teeth out, but it really does help you to chew properly, sound out certain sounds properly, things like that.
Mhm.
So like you said, they're not just child teeth. We also want to just get the habits down now before you're into adult teeth that have no replacement.
Yeah.
Um, you don't want your kids in pain. Like, even if they are the first set of teeth, we want to take care of them. We don't want kids in pain, missing school, not being able to sleep well because they have cavities or
Yeah,
dental infections.
I know. And so piggybacking off of that, I always tell my friends, like, make sure your kids don't like I'm one of those friends that sometimes gives unsolicited dental advice. And so like when I see siblings like sharing, like spoons and those types of things, I'm always like, oh my God, I hate to be this person, but please don't let your kids share utensils and water bottles and stuff.
Yeah.
So can you just explain a little bit about that? Because I think even though we know, and it's very commonly known to us, other people don't know. They're like, what? They're siblings, like they're fine, and they're babies, like
Yeah.
their mouths are so clean, right?
Yeah.
So can we speak a little bit on that?
Absolutely. So, for the people who are non-dental professionals out there, you are not actually born with the bacteria that causes decay,
Yes.
dental decay. You
Yeah.
have to pick it up from somewhere.
Yes.
Our bodies are not born with it. So whether that's from a parent, a caretaker, a sibling, friends at daycare when they're all licking the toys and passing it around to each other, that water bottles, utensils, so it gets into a little bit of a hairy or a sticky situation because, and I know you've talked about this before, like
Yeah.
kissing your baby directly on the lips. I'm not going to tell anyone to not do that, but just giving the information, if you are a person who has high cavity risk, has active decay, or has had a lot of dental decay in the past, then that means that you have an elevated cavity risk, elevated bacteria that causes cavities, and you can absolutely spread that to your
Yeah.
child. It's germs just like any other germs, and it spreads through saliva,
Yeah.
through anything that is direct contact from mouth to mouth.
Yeah. And then once the bacteria is established there, like it's there,
It's there.
So
Mhm.
the goal is to prevent it from establishing itself there. Because if you can get your kids to a certain age of not having cavities, they're much less likely to have cavities later in their life. So good cleaning habits with their teeth, flossing,
Mhm.
even like I remember with my she's 2 now, but like when her bottom teeth came in,
Mhm.
and a lot of kids have space between their bottom teeth, but my youngest one doesn't, which will probably be problematic later, but that's a whole nother story. But like I was flossing her teeth and she was like maybe 1, and my nanny was like, who flosses a 1-year-old? She's just like, oh, you're crazy. And I'm like, no, no, no. Like you have to floss their teeth. Like you have to
Absolutely.
do it. And so flossing, brushing, and I
Yep.
think
Yep.
diet is super important because
Absolutely.
things like raisins that like stick onto their teeth and stuff,
Mhm.
those are just like a nightmare for kids.
Nature's fruit snack, I call it.
Yeah, yeah. Like anything sticky or like
Yeah.
that really just sticks in all the grooves of their teeth, those just like lead to so much decay. It's like we
Yeah.
just got to be really conscious of like let them be kids and let them eat and let them enjoy,
Exactly.
but
Exactly.
also like don't give all the snacks all the time.
Yeah, and I think it's very much, and this is where that like individualized care comes in, because you've always heard, people have heard the stories where this person never ever brushes and flosses and they eat terribly and they never get cavities, but maybe they didn't have a caretaker or someone like that who swapped utensils with them a lot and they didn't get that establishment of all the bad bacteria. So it's very individualized. So in general, when we give these pieces of advice like, keep the artificial sugars down or keep the refined carbohydrates down, things like that. Some people may be able to get away with more, you know,
Yeah,
not so nutritious foods and not get cavities, but you also have to know your lifestyle and your kind of like other factors that go into perhaps creating cavities as well.
totally. Okay. So last but not least, let's talk a little bit about airway.
Yeah, yeah, let's do it.
Okay, tell us
Uh,
all
it,
the things about,
oh my
maybe not
gosh,
all the things,
I was
but
gonna
tell
say,
us some things about airway.
where do I even start? So you brought up like spacing
Yes.
between teeth. A lot of, we'll do this. How to potentially notice if your child has an airway or a
Yes.
tongue tie issue. Let's do that.
Yes.
Number
So
one.
I just
Mhm,
wanted to say, like, so many people don't look for these signs. They are not aware,
mhm.
and it's not their fault. They just don't know. And so
Yeah,
that's one of the
exactly.
reasons we wanted to do this live, is to kind of like help you see if your kids, you're noticing any of these with your children, so that you can
Mhm,
get the help that you need before it's a bigger
exactly.
problem. So,
Exactly.
yeah.
And I will say a lot of like general public, but also a lot of dentists and pediatric dentists don't even know these signs. So it's really important to specifically go to an airway focused pediatric dentist if
Yes.
you're concerned. But number one, I would say, yeah, is lack of spacing between the baby teeth. You know, you'll see like ads or commercials on TV, and it looks beautiful when the baby teeth are all nicely aligned and perfectly together. But in my pediatric dentist brain, I'm like, alarms are going off, like, ooh, there's probably something that's not allowing that jaw to naturally get that growth that we want, whether it be a tongue tie, bad seasonal allergies that's causing mouth breathing, big tonsils, something like that.
Mhm.
So I would say a lack of space between the baby teeth.
And which
Another,
ones? All of them?
all of them.
Or just, okay.
Generally speaking, we see a good amount of space between the front teeth, maybe a little less between the back teeth,
Mhm.
especially as they get a bit older. But generally speaking, if you don't see spaces, especially between those front teeth, that's a good indication there might be an airway issue. Teeth grinding at night
Yeah.
is a big one. I would also say with sleep, just kind of wild sleep, flip flopping all around. I always say looking like a floppy fish, just like kind of flip flopping in the bed, not waking up feeling refreshed. Or for the older kids, waking up multiple times in the night, especially to go to the bathroom, is a big one. Snoring, mouth breathing,
Yeah.
or just in general hanging open at rest are all signs. Or like if you turn to the side and you see your child like kind of head posturing forward, postural changes can be a big sign. That's literally them trying to
And can we talk a
open
little
up.
about like the facial features? Because we talk about this sometimes where like I see like the cutest little baby and I'm like, oh no. Like I know, like I could just tell by the facial features of like that there's an issue, and it's like, I don't know them, so I can't like go up to them and be like, by the way. But like I am always hoping that they're getting some kind of
Yeah,
treatment.
yeah,
So can we talk a little bit about some facial features that
yeah,
somebody might notice?
absolutely. Like I said, open mouth at rest just it
Yeah.
doesn't even have to be just like mouth open at rest, the droopy eyes, kind of more downward slanted eyes,
Hmm.
circles or redness or darkness under the eyes. And I'm talking like little ones because, us adults, a lot of us have circles under our eyes for many reasons. But for kids, we call them allergic shiners or Venus pooling because underneath those eyes, it gets really like dark red and just kind of overall droopy, tired looking. For a bit older kids, kind of a more longer, narrow face, just really skinny and kind of long. Those are all good signs, good facial feature
Yeah.
signs of
Of an airway issue. Yeah.
and
And
teeth kind of again from the side, like if you see those top teeth really coming out or the top jaw really coming out further than that bottom jaw and or the bottom jaw just pushed back,
mhm,
those are all good facial feature
yeah.
signs. Mhm.
Okay, cool. Thanks for sharing that. And then, yeah, I guess maybe like last thing of like, when do we try to kick oral habits of like, let's say pacifier? That's a big one. People are like, no, I can't. My baby can't live without the pacifier. And so like, at what age do we want to break that pacifier
Yeah,
habit? Or the thumb
no,
sucking or
yeah,
the use of the bottle, like
yeah.
all of those things.
All of those. So it's considered prolonged if it goes past 18 months, which I know shocks a lot of people because they're like, what? My baby got a pacifier till 3. It's considered prolonged if it goes past 18 months because that's when we can start to see those changes in the jaw shape, in the teeth position, and honestly,
And narrowing of the
the narrowing of the
airway and the
airway.
palate and everything.
Exactly,
Yeah.
exactly. Because if their bones are so mushy and moldable at that age, anything in there pushing like your palate literally wraps around anything that's in there. So if the thumb is wrapping around it and just causing the squishing in of the whole face and airway. Um, and the longer you keep it around, the harder it is to get rid of.
Yeah.
Um,
And then
but
I
I
have to
will
say, on the other end of it, I see the adults that had these habits as children, right? And now they have like open bites. Like
exactly,
their front teeth don't actually like overlap. They're like
exactly,
there's an openness to them. They don't
exactly.
touch. And then their palates are very narrow,
Yep.
right? And
Mhm,
as you age, you lose collagen in your face.
mhm,
Like the distance between your nose and your lip gets even bigger. And so
mhm,
they start to say, like, well, my smile is just like completely disappeared and it's
mhm,
gone. And I want like a big, pretty smile. And it's
mhm.
on my end, it's a little bit more difficult because we're taking a narrow
Yep.
arch and trying to make it look big. And
Yeah,
although we can do a good job, it's like if you see these habits in your kids and you can avoid, you can try to help them when they're
exactly,
little and change the
exactly,
trajectory of their adulthood, you know, because
exactly,
later in the
exactly.
adulthood, it's like, you know, and it's one thing aesthetically, but it's another thing when it's also a functional thing, like when your teeth don't come together properly and all of
Yep,
that. And then it's like
exactly.
they might even need orthodontic surgery. Like there's so much that
So
you
much.
can avoid just by helping them develop more properly as young ones.
Exactly. And that's the thing, because outside of doing things like surgically assisted expander as an
Yeah.
adult or surgery as an adult, it's more you're covering up aesthetically, covering up a true actual issue. If we
Yes.
can get to that true actual issue and nix it when they're younger,
Yes.
then you can get that natural growth.
Yes.
But yeah, so by age 18 months is when we really say try to have these things like out, no thumb, no pacifier. I promise you, your baby will survive without a pacifier. I
I
promise.
know.
It might be a few sleepless nights. I know it's tough as parents, but the other end of it is some things like we talked about airway issues, orthodontic issues, just speech even can be impacted. So we just really want to try to avoid those things if at
Oh,
all
that was
possible.
another thing that you and I had talked about before that was interesting of um like being focused in class, right? And like um I think that
Yes.
was related to a tongue tied issue or something, right?
Mhm.
Because like the kids aren't able to focus and like do the work and all of that. And then like because they're so uncomfortable and they don't even
Exactly.
know it. And then
Yep.
when like
Yep.
their speech is better because they've had that release. Sorry,
Exactly.
I'm like flip flopping all over the place,
That's
but I
okay.
remember that you mentioned about that. And I was like,
Yeah,
that's so interesting. And like all of a sudden their attention span is better. Like it's not that they
exactly.
have ADHD or anything. It's just that like they're super uncomfortable. They can't speak as well as they want to,
Yep.
and they can't
Yep.
focus.
Yep.
And so,
Anything causing that airway issue, especially overnight, like bad allergies, tongue tie, um, any of those things that cause an airway issue, especially that impacts your sleep,
yeah,
kids tend to, us adults, we get more tired. Kids, they tend to go the opposite way and get more antsy, get more rambunctious, and just cannot focus. I'm not saying ADHD doesn't exist, but this can compound the issues or sometimes even have them misdiagnosed as ADHD when really there's some type of airway issue going on that's not allowing them to get that proper refreshing sleep, that deep sleep that kids need to be able to recover and to be able to
totally.
concentrate the next day.
Okay,
Yeah,
great. All right. So I hope you guys enjoyed this. If you have any questions, please reach out to either of us. And if you reach out to me, I'll probably direct you back to Dr. Erin.
that's fine with me.
And so, yeah, Erin, is there anything else you wanted to say?
Um, I mean, there's so much I could
I
say,
know.
but I think I'll just leave it on the that the baby teeth are very important, and it's not just their teeth; it impacts everything. Start taking your child to the pediatric dentist at age 1 or within first 6 months of first teeth coming in, so that we can assess all of these things.
Yes. Perfect. Thank you so much for joining me. We'll have to plan another one. Send us your questions. If we get enough questions, then we will plan another one sooner rather than later.
Sounds
All
good.
right. I'll talk to you soon.
All right,
Bye.
bye.